So, welcome to the Child Psych podcast. We're so excited to have you here today.
Well, thank you, Tammy. Thank you for inviting me.
Yeah, I think the reason I wanted to take this podcast instead of Tanya in particular is because my specialty is treating trauma in children.
Hmm.
And the way you've developed polyvagal theory in terms of looking at the stress response in adults and children, especially the neuroception of safety, which we're going to talk about,
Hmm.
revolutionized how we look at how the body and the brain really work together. And instead of looking at children as willfully disobedient, especially kids who have had
Yeah.
hard start in life,
Yeah.
I feel your theory just lends to so much compassion and understanding that you can't the brain and the body work interchangeably. You can't disconnect them. Like,
Hmm.
so really excited to really delve into this, your theory, and then how we apply that to parenting.
So if we're parents or teachers, we wish we could disconnect the body from the brain.
Yeah.
That's because what we're going to basically start off with this kind of metaphor or little analogy. If there's a battle between your intentional part of your brain and the brainstem that regulates your physiological state, basically the foundational survival circuits in your body, who do you think will win? So if your body's in a state of defense, forget the intentionality. It's just not going to be there. And when you mention the word compassion, that's what we have to think about. That why is the body in a state of threat? Because the body itself is detecting cues of threat and literally is interpreting the world, at least for the child, that the world is a very, very dangerous world.
Yeah, and how okay, so let's start so our listeners can I have already have an understanding of polyvagal.
Mhm.
So why don't you explain your theory and how this kind of what this has to do with safety, because parents are going to, that might be hard for them to wrap their heads around when we're talking about
Yeah,
neuroception of safety.
Mhm. Let's start off with a simple principle, which most of us have forgotten because we're both either parents or we were children at one point, and that is our physiological state influences our behavior. And we tend not to acknowledge that. We think that behavior is intentional. And we come at it literally in educational world and parenting worlds with literally a behavioral worldview that if you really want to be sit still and to listen and to process and be polite, you can. We tend not to understand that when our body gets into certain states, like states of threat, the only priority is our own survival. So we have to start understanding that basically, if the body shifts state, better get you want to get off that horse. So if it gets into a state of mobilization and aggressiveness, you're not going to make a contact through intentionality or through punishment. So polyvagal theory starts with this premise that in between the external world or stimulation or stimuli or cause and the body's response or the effects is our nervous system. And our nervous system can be in different states. It can be in this calm state where it supports health, growth, and restoration. It can be in a calm state where we're contemplative and we're thoughtful and we're generous and benevolent. Or it can be in a literally a state of fight flight where we mobilize all our resources to protect ourselves, or in a state of literally overwhelming threat where we shut down and disappear literally within our own body and become numb. And you see all three of those attributes in virtually everyone's life. And you see it in the classroom, you see it in parenting. And the issue is to understand that those physiological states are functionally neural platforms for the behaviors that we have.
Yeah, so I think we are taught, when we think of psychology and the rise of behaviorism, that, a child does X, Y, and Z, that you add, either reinforcement or you add
Yeah.
punishment, and that the child has a choice. But ultimately, if the child is in a stress response, they've exited the logical
Mm.
part of their brain. So they're out
Yeah.
of their prefrontal cortex and they're in their sympathetic nervous system or parasympathetic,
Yeah.
depending. We won't get too
Yeah.
much into that,
Yeah.
but that they're in a state possibly of fight flight, where
Mm.
they're kind of, I think Mona Delahook calls it, that would be your red zone, where
Mm.
they're kind of in that state of protection where they want to exit or they're going to get aggressive to protect themselves, or they're in that numbed out, shut down
Yeah.
response. But ultimately, it's all states of fear, protection, and
Yeah.
stress. And parents have a hard time with that because they'll say, well, my child just got the wrong color of cup. What does that have to do with safety? And what would you say to that? Because I get
Okay,
asked that.
so it's very simple, and that is what actions trigger a nervous system to move into a state of threat. The simplest one is violation of expectancy, which is the example you gave. Because expectancy to our nervous system is literally open ended. It could be open ended, which means it's threatening. So when we deal with what we would call flexible and resilient children, violation of expectancy is fun. They like that. It's exploration. But if your body is a little bit tentative in this world, in the sense you're very threat or conflict aversive, then violation of predictability is triggering the body to be in a state of threat.
So is it the unpredictability is what I'm hearing
Yeah.
that when, and I mean, the
Yeah.
more anxious the child, the more
Mm.
difficult that is when they don't have control, when things don't go the way they want.
Yeah, we can play for a moment with the word anxious. So we think of it
Okay.
as a psychological one, and we say to people, "Why are you so anxious? Don't be so anxious." Let's throw that word away and say, "What if our body's in a state of threat, and our psychological experience is that of being anxious?" Do we change the way we treat the child or treat ourselves or others? We say, can I calm my bodily down? Then the anxiety just won't be there. So we have to understand that the psychological experience of anxiety is the brain's interpretation of a lower brainstem state of being in a state of threat, a foundational survival threat response.
Okay. So, with your theory, how do you, with polyvagal theory and looking at like the parasympathetic versus
Yeah.
sympathetic nervous system and the vagus, the vagus nerve, all of those pieces, how do you think this changes the paradigm in which we parent when we look at how the body governs our kids? And then how
Yeah.
does that, I don't know sure if you have kids, but how does that govern our responses as parents?
Well, parents are humans too, so we have to
Hmm.
start there. Parents are under states of threat. Parents, in terms of parenting, it's a lot of uncertainty as well. So, being a parent in itself is a lot of threat reactions because you're trying to be helpful. You don't want your child injured, but you want your child to be predictable. It's a complex set of demands on parenting. It's much easier when your children are grown up and successful. Then you can sit back and say, "Wow, what a journey!" But look, they're out of the house some of the time. But the point is that we tend to think of behavior as being intentional. And I think that is really the take home message from polyvagal theory. What about all the behaviors that are being driven by our physiology being in a state of threat? Then we get into the question, what is triggering the threat? So let's separate that we are physiologically a lot of anxious kids, a lot of instances, a lot of depressed children now, a lot of suicidal thoughts. These are physiologies that are not safe. So they're not supporting health, growth, and restoration. And we get confused. We start thinking of these as psychological phenomenon, meaning they have no physiological validity. But threat reactions are on mental levels, psychological levels, behavioral levels, and physiological levels. So that's why you start getting all these comorbidities. So when you're looking at children, highly anxious kids often have a lot of gut problems. Now, what is that all about?
A
Well,
lot of,
it's because
yeah,
a lot of them. And
yeah.
what it's telling you is really that their nervous system is not safe enough to support these processes that we'll call homeostatic, which are health, growth, and restoration. So, being in a threat state, our body shifts priorities rather than taking care of its own organs, healing, growing, digesting food. It's in a state of threat. The analogy is Star Trek, where the Enterprise, the spaceship, has to move its energy from power to do various things or fight or fly to put up defense shields. The defense shields are metabolically costly. They divert the nervous system from its primary goals of health, growth, restoration, and sociality. So, what we start finding out is the anxious child, the child with the gut problems, often has social behavioral issues as well.
Yeah. And I know in your gut too, I'll give you an analogy that we give clients, and you tell us if now you're going to tell us if this is right. When we think of emotion regulation, so our child is having a tantrum, or your teenager says you're the worst mom in the world, whatever that is, like it's a big moment. There's a big feeling there. What we tell everyone who works with us, our clients, our podcast listeners, is the first question we want to look at is neuroception of safety.
Hmm.
Say, does this child feel safe? The second question is, do they feel loved? Limbic system response connection. The third question is, do they feel capable? Can they understand? Can they problem solve? But the
Hmm.
first thing we do
Yeah.
is look at the body, and we look at that
Yeah.
neuroception of safety. And we look at that at different facets, being like sometimes even kids who aren't nourished enough, that there's gut health issues that can precede
Mm.
dysregulation, because so much serotonin and dopamine is made in the gut. So
Mm.
then they have a hard time regulating their feelings because their serotonin can
Mm.
often be, well, we see a lot
Well,
of mental health stuff.
we can keep it even simpler.
Yeah.
If you're in states of threat, the gut's not it's not providing the nutrients, which could be neurotransmitters that our body needs to regulate both on a behavioral, social, and physiological level,
Mm-hmm.
because threat and life threat, above all, is taking priority. And this is where the theory starts taking some really deep roots, because we can understand that it's not a bad behavior. It's behavior at the service of survival. So we could call it very adaptive, but functionally it is maladaptive in the local environment. So for some reason, and this is where the clinical history, therapeutic interventions, uh, signals of threat are overwhelming that child's nervous system. And that's this neuroception. So what makes us and other social mammals unique in the whole, family of vertebrate species is that not only can we detect and react to threat with a neuroception of defense and reactivity like a startle or pain, but we have a newer mammalian circuit, and this made the system polyvagal, that turns off threat reactions. So our whole nervous system evolved to enable connection and co-regulation with another.
Mm-hmm.
This is this remarkable aspect of signaling another of your species. And we can see this very easily when we have pets. So you have a dog or a cat. How do you talk to your dog or your cat? You use a very prosodic with intonation. Now, the question is, do you talk to your children the same way?
And
Not necessarily,
not
because
if
you
they're
want to, quote, straighten them out. But what about your cat or your dog or your horse? You talk to them, say, pretty baby, lovely this, or,
easy. Yeah.
yeah. And the animal gives up its defenses. And for cats and dogs, often they roll on their back and say, rub my belly. They're showing a very vulnerable ventral side. They're basically connecting and feeling safe with you. But we treat humans not on that level. We say you should be smart enough to understand what I want and what I mean. Uh, so we think it's all about what I say and not how I say it. So,
That's such a beautiful analogy, because people, I mean, I have horses, I have dogs, I have cats. So I get that. When they are in a state of stress, whether I'm training or just like we're
yeah,
hanging around the house, that's very quick. You move towards
yeah,
you. Well, sometimes eye contact might not be appropriate, but you go to the shoulder and you give them a pat and say, easy, easy, or it's okay, it's okay. And we do that social dance, which is co-regulation and saying, I've got you, it's safe, it's going to be okay.
mm,
I rarely look at my animals and say, this is willfully disobedient. They're like, no, they're scared. Like there's this behavior they're doing because they're stressed. But with
mm,
our kids, we forget
mm,
how underdeveloped the brain is, that when they're in that state of stress, they don't have, while those parts of the brain are developing in our kids, they're very underdeveloped. That
mm.
hardware for logical thought and problem solving and self-regulation, they're not done till close to 30. So we sit there and say my child should be smarter than their feelings, and it's like, well, that's not how this works. Like first we have to take care of the body being safe. They need
Mm.
co-regulation so they can even access those
Yeah.
parts of the brain that could regulate, that could problem solve, that could be logical.
So there's a real, we actually did this study that got published looking at babies, 9-month-old babies, when their mothers placed them under a stress procedure, which is called the still face procedure. It was
Oh,
developed by Ed Tronick, a real good
Oh,
friend of mine. But
oh.
you're already grimacing because what it is the mother basically
Face goes flat. Yeah, no,
goes
no feeling
flat.
in the face.
And the initial reaction of the child often is to reach forward to try to literally comfort the mother and reconnect, even at 9 months. And then the child will get disorganized and go into tantrum at times. But the interesting part from a polyvagal perspective was the voice of the mother where she calmed the baby after the disruption.
After.
And we looked at distress indices of behavior and the baby's heart rate. If the voice was melodic,
Mm.
the baby's heart rate went down over 10 beats per minute within a few seconds, and distress behaviors literally disappeared. But if the mother was still talking and engaging the child, but her voice was
Flat.
less prosodic, virtually no effect. So it's telling you that there are signals of safety that are wired into our nervous system. And this is what we're talking about with pets. We intuitively know how to talk to our pets, and we should intuitively know how to talk to our children. We do with babies. So for many people, they initially, when they see a baby, they'll go into this a lot more intonation, a higher pitched voice, and those are wired into the nervous system as signals of safety. So it's a neuroception of safety, which is part of our evolutionary heritage of calming our bodies down, because you can't develop connection or trust in another unless you have that co-regulation where the neuroception detects signals of safety. So
Yeah.
remember, actually, this is a predator's behavior is like, you can trust me. And of course, this is how people actually, that's really what's happening to the child in a school system where the child doesn't want to go to school and the child is really uh, uh, basically wanting to stay home. And the parent says, trust me, go to school, everything will be fine. And it may not be fine for that child. There may be too many cues of threat. Could be bullying, could be other things.
Yeah. Well, I think of this whole idea of co-regulation, and I think of discipline with kids, and that parents, I don't know who got it in their head that locking a child in the bedroom was a good idea when they were dysregulated, but parents wonder why we advocate for time ins where you move into a quiet space with a child, you stay with them, you don't use a lot of words, you use that melodic voice, you stay put, you
Yeah.
sit on the floor and wait for the child to downshift essentially into that lovely parasympathetic, hopefully, response and into social connection. And parents are like, well, they just need to cool off. And really, it's probably the parents that need the cooling
Yeah.
off.
I think we have to be a little bit more, not we, I'm just saying for me, you can be whoever you are, but in a sense, being compassionate to parents.
Yeah.
And the room where the child can't hurt herself or himself.
Yeah.
But more than that, gets the child away from the parent who basically is in the physiological state of rage by being so disrupted by a child's behavior. We can start seeing the utility of some of these timeout types of
Mm-hmm.
sequences. Now, we're demanding in the perfect world, the parent can deal with all the disruptions, and the parent's nervous system does not move into a state of threat, but moves into a state of compassion and caring and tries to calm. But remember, we're human, and parents are often with their kids frequently after work, and work can be tired. So there's a lot of load on the parent. And I'm saying we have to step back and understand it's not a perfect world, especially the world of how we treat children. But what can we do to optimize those experiences?
Yeah. So what I often tell parents is the best case scenario is we co-regulate because co-regulation precedes self-regulation. We
Yeah.
need co-regulation before self-regulation as human beings. That's how we learn actually to
Mm.
self-soothe. Eventually, we first have this co-regulation. Not that co-regulation stops though. We do it with our spouses, we do it with our friends. It doesn't stop.
Mm.
But the ability to just self-regulate, I was like, no, the young, especially young children don't really do that. But I always tell parents the best case is you stay with your kids when they are in having big
Yeah.
feelings. But if they feel they can't handle their child's feelings, they're going to hit them, they're going to yell at them. They feel unsafe in their bodies, sometimes
Yeah.
we do need to step away. But that's not teaching the child to self-soothe. That's the parent needing to calm their nervous system so they can go into co-regulation. So it's
You-
like a timeout for them, not the child.
Right, exactly. And what's happening with co-regulation, why it leads to self-regulation, because it builds memories of that soothing person near you in the past. So it's the top down now. So self-regulation requires the antecedents of successful co-regulation, which develops a top-down template of being co-regulated.
Okay, perfect. Let's take this outside of the regular parenting paradigm and talk about kids with trauma. So,
Mhm.
how does this, your theory, let's just bridge that to kids who have had a lot of neural damage because of really, a really hard life to begin with, whether that's abuse or neglect, um, traumatic incidences, car accidents, such. What changes in their nervous system compared to a neurotypical child?
Okay, the nervous, okay, what trauma does, and we have to respect it for what it is, and we have to move away from the event and ask the question, what did the event do to the child's nervous system? Because trauma is embedded, it's a reaction, it is not the stimulus. And this is really, again, a cultural problem where people will say, well, I got through that, you can as well. And, or we might say, oh, that's trivial. Yeah, come on, get over it. I mean, we treat people in that way. We don't listen and witness their experience and say, this was catastrophic for me. It disrupted my whole life. That one episode. I know it's foolish, but I'm a different person now. And you hear stories like that. A child, I mean, you can talk to adults who may have been humiliated in high school and that they never forgot it. It's still there and it's transformative in their life. The interesting part of all this, your real question is, what is the process? What is doing this? The autonomic nervous system has been retuned, and that's a term I like to use because it means that we shifted from this co-regulatory, calm, even playful, where we can both use our social engagement behaviors and mobilize. We call that play, to where now our body has to protect us all the time. So people or children with severe trauma histories get locked into an autonomic state of defense. They're basically retuned to be uh, threat reactive all the time. And you can see this often in, let's say, foster children, in adopted children from who have very hard histories. It's very difficult because what's happened is that their bodies have been in physiological states that did not allow trust to occur. And
There's no social
there's
connectedness to
there's
help
no
soothe
connect,
the.
right, the trust. But let's even go into the in the world of trauma. We hear these stories and we of basically abuse within the home, and some of these stories are really profound abuse on multiple levels. And you say, how can any biological parent, or even let's say an adoptive parent, treat a child in that way? And the answer is they're not treating the individual as a child, they're treating them as an object. And there's tremendous damage in those strategies because there's no reciprocity, there's no symmetry, there's no co-regulation. The part I think that the take home is that their nervous systems have been retuned in a very predictable way. And the predictable way is to promote their own survival. So now we see what looks like really disordered behavior. And we see it now in a different light. We see it as really heroic strategies that a child's nervous system is implementing just to survive.
Yeah, I always tell parents the brain's number one job is to keep us safe. It's
Yeah.
survival, and that comes above all else. And until that child can know that their environment is predictable, that people are safe, that their needs will be met, the brain doesn't heal. And that's why, when we do trauma trainings, everyone wants strategies and all these complicated things. And I said, the first thing you have to do is that neuroception of safety. That
Yeah.
child needs to know what's coming next. They need to know that caregiver is predictable. When they have a
Yeah.
tantrum, the parent is going to respond a certain way. They go to bed at a certain time. Everybody in that child's life responds similarly. So we want to look at the whole system, not just the parent. What are the teachers doing? What are the educational assistant doing? What's the nanny doing? That child knows that world has a rhythm to it. And
Yeah.
until that child can kind of count on that rhythm in their life, and that people are going to be attuned to them and predictable and loving, it's difficult to move past that piece on to strategies, really.
Oh, I totally agree. I mean, you have the essence of an approach. It's very consistent with polyvagal theory, in that is signals of safety enable higher brain structures to reorganize your life. But if you're locked in the state of threat, those higher brain structures are basically turned off, or they're not totally turned off. They're just accessible in a different way. And you often see people who have trauma but now are, let's say, academically successful. They become isolates. They start using academics or work as a way of regulating their physiology,
Mm.
as opposed to seeing academics as a social platform for learning. I think that's part of what we've really missed in the school systems as well, that we didn't merge sociality with the educational process. Yet, I'm going to say for many of us, that was the major, I would say, the benefit of going to school was the friendships, the relationships we built.
Yeah, definitely. I know, as a person who had significant trauma in their childhood, academics was an escape for me. Like, I can be
Yeah,
completely honest with that. And as a result, I have to push myself socially, because it's much easier to go, to focus on writing or focus on work than sometimes to go into connection, when you're very young and there's a lot of addiction and a lot of things going on in the home,
yeah,
is not safe. So
yeah.
yeah, this speaks to me a lot.
But
Yeah.
but for you, you have, in a sense, your own history as a laboratory. Being very smart and very sensitive, your own experiences can be deconstructed, and you can start seeing these basic principles acting out in your own life.
Mhm.
And then with our intelligent self, we can start structuring connection and co-regulation at the level that our nervous systems can handle. So what you're really saying is you were retuned to be more tentative on the social level.
Yeah.
And I'm saying that as you get successful and learn balance in life, you titrate what you can handle. And so I was going to introduce one other thing. What
Yeah.
what the pandemic did for many of us, and the pandemic was everyone was thinking about school as a cognitive task, on Zoom, and basically said the virus was the pathogen, was the threat. Well, it was more than that. In general, whenever our nervous systems are affected with threat, we mitigate the threat through co-regulation with others. But with the pandemic, the other became another threat, and our nervous systems, like mine, basically uh, felt this great thirst for social nourishment. And then when we started to go out again with other people, my nervous system said, I can't handle this. It's too much. And I just can't imagine what it's like for young kids, because when I reflect back to my childhood, sociality was the major part of life. Excuse me. Uh, that life without playing with other peers, just you didn't play with your parents. That wasn't the world you wanted to be in. So it was peers were everything, and the pandemic took the peer out of that equation
Yeah.
as a
No,
co-regulator.
and now we're seeing, just, I ran a clinic for about 10 years, and I still run an animal assisted therapy program here at my
Uh,
ranch. And yeah, it's great, by the way, for trauma, with the limbic system and the brainstem work. But side note, what we're seeing are a lot of kids with avoidance behavior now, more
yeah,
than we've ever seen. And I mean, anxiety wasn't great before. It's even worse now, with kids just not wanting to engage socially. Like, they don't want to go to school, they don't want to do extracurriculars, they want to stay home.
yeah.
And I guess, without getting too much into the therapeutics here, what would you say to those parents who have these kids who are just like, I don't want to engage socially after this
Okay,
post pandemic?
so first of all, I'm not a therapist, but
No.
I can think like one occasionally. I'd like to ask parents,
Yeah.
what is it that their child likes?
Mm.
What puts a smile on their child's face? So it gives you a sense of what they like to do. What is the activity? And you want is activities that require interactions with others. So it's not more screen time. It's or interaction with pets or other animals has some of the same benefits as you know as a you do equine therapy.
Yes, I do.
Yeah. So in a sense, it's a wonderful surrogate. In fact, horses tend to be, and dogs tend to be more sensitive in many ways than humans, in a positive, reciprocal way. So I tried to say, what is it that puts a smile on your child's face?
Yeah.
Then I say, what? Let's say it's an amusement park, and you say, well, if you went with your child to the amusement park,
Mhm.
so the idea is walking into that child's world of the child having pleasure.
Yeah. And
I,
titrate it from there and bring it
yeah,
up and
going to give you another example.
mhm,
We rescued a cat. We have a rescued cat. It's 2 years
mhm,
old. It's a big cat. It's 16 pounds. It's a beautiful cat. But, it's been a while. We had dogs, and I hadn't had a cat for a long time. And I started to look at the cat and understand cat strategies. And in a way, we're going to start talking about therapy from a cat's perspective. And what that really means is the cat's not going to follow your lead. A dog may, a child may, but the cat won't. But the cat will use you to co-regulate at the cat's whenever the cat needs it. Like she needs to be near me, she'll come near me. She wants to get on my lap, she'll get on my lap. And she doesn't like to be alone. She wants me in her proximity, but she doesn't always want to be petted. But there are times when she feels so good, she goes on her back and the belly needs to be rubbed. And she also wants to invite me to play, which for cats, you have to be a little careful. So, we do have the right tools. Basically, it's like a fishing rod with rubber fish that she can play with and
yeah.
pull on. And it's not biting into my hands, but it's play and engagement until she no longer wants to. And that's what the cat is telling me. I'm important to her style of co regulation, very important, but she doesn't co regulate like humans do, or like dogs do, or horses even.
Yeah.
So it's really interesting to watch. And you learn from that and say, well, if I looked at children that way and said, what if I were a parent who saw my child like a cat, who realized that my child needed me in proximity, needed me when my child needed me, but wasn't always going to be there when I thought I wanted or needed the child.
Mhm.
Uh, so it's a asymmetrical strategy, but I think it gives us insight into this whole notion of physiological and biobehavioral regulation before we start demanding constraints on others.
Yeah.
It was really interesting with the cat because my wife started to label some of the cat's behaviors as bad. It's like, like she would nip, the
Mm.
cat would nip. I said, it's a cat. Cats nip. They want to do that. They think it's play, but they have very sharp teeth. So what does that tell you? If you're a good co-regulator, you don't put your hand in the cat's mouth
Yeah.
because you don't, right? Because it's very sharp teeth. So if she starts to do that, you get the toy. So she can still now have this fun and play and interact with you in a regulatory way. And over time, the nipping behavior is disappearing.
Yeah. I would say too, which brings bridging play is so important with kids. I'll give you an example. My son recently refused a needle at school. And, the nurse calls me saying he did the first shot, but he didn't take the second shot. He was crying. And I was like, oh, it's okay. I'll take him to the health clinic and well, actually, I'm going today to take him to get the second shot. And what was very interesting is we're big on play in our house. And so knowing what I know as a trauma therapist, not that this was a big T trauma, but I made sure that a pretend needle was available and a doctor's kit was available. And almost immediately he went into giving our dog needles. Okay. So giving like he was doctoring him and doing that. And it was interesting allowing that process to happen. And then, we talked about getting the needle, but I knew what was important was him playing doctor, like
Yeah.
that play that happens. And I was
Mm.
nearby. So there's co-regulation, proximity
Mm.
if he needs it. And now today he's like, yeah, I'm ready for my needle. And I'm just always
Wonderful.
amazed about the power of that social connectedness and then play for kids to help
When
regulate the experiences that are very scary to them. But kids are often deprived of that play that they
Hmm.
need to then handle stressful situations when they're quite young.
So we have to really start thinking about what is play. Play is mobilization usually. Mobilization under threat is called fight flight, but play is mobilization with the social engagement, with the face working, the smile, the vocalization, and proximity and contact with another person. Or an animal, we play with our pets. It's the reciprocity. It creates a co-regulation while moving. I think the dance movement therapists had a lot of insights, and I think we'll start finding that in the world of trauma, movement oriented therapies are going to be very, very helpful. And that's why play therapy is becoming very popular now with
Uh,
children.
I'm a registered play therapist, so
Yeah,
that's what we would use. So
yeah,
one of the things hopefully people are listening can take from this is, kids, especially younger kids under 10 who have had a lot of trauma or scary things happen or avoidance behavior, often allowing for non-directive play or finding a play therapist can actually be a quick way actually to work through a lot of
yeah,
avoidance and anxious behaviors. It engages actually basically every lobe of the brain, so it's instead of just being cognitive or just body based,
yeah.
it's a combination of those kind of three levels of the floors of the brain, if we're going to simplify things.
Hmm.
Is wonderful. And also for parents who have kids who are very avoidant, I find because social connection and co-regulation is so important, one of the first things I'm going to do is try to bridge that child to an attachment figure at school, of being like, if that child needs co-regulation at gymnastics or in
Hmm.
swimming lessons or in the classroom, we need to find an adult. And it might not be the teacher, it might be the
Yeah,
school counselor, it might be their
hmm.
teacher from last year, but kids often need a safe landing place in a social
Yeah.
situation. And unless that child is familiar with the adults in their space, they often can't, it's very difficult to ask them to go to school if they don't have
Well,
connection.
so Tammy, so one of our colleagues did a study. She does research in schools, and she had a whole school evaluate with a map of rooms and sporting venues where they felt safe and where they didn't. And it was very interesting. So, of course, we were the dangerous part. And this was really more like, I think it was a high school because the parking lot was viewed as very dangerous.
Mhm.
The stairwell was very, very dangerous. But the area in front of the counselor's office was very safe. And what I found almost paradoxical was that the football stadium was safe. And I started to think about that. And that was, well, you're with people, you're oriented at others, you're not literally vulnerable when you're sitting there. So there's activity, it's more of a co regulatory experience.
It's
But it
playful
was,
too. There's
yeah,
games going on, you're
yeah,
cheering, there's
yeah,
parallel play. Yeah.
yeah, yeah. I was okay, I was shocked by the amount of space in a school and that was viewed by or felt as being unsafe. Uh, it's I think what we're getting if we with the right tools, we're getting the child's perspective of the world they're in, and remember, so much of the child's life is through our eyes, and where we're basically making decisions about what they should experience.
Yeah. Versus actually entering their world and seeing how they
Yeah,
perceive things.
yeah,
Yeah.
and that's the cat perspective. You want to be more like the, you know,
Be more like a cat.
yeah. Well, not you. You have
No,
a
no, but
sense of treaty.
put put yourself in the cat's perspective a little bit. Like,
Yeah,
what is their world? Like, how are they perceiving this versus how we
yeah,
think they
yeah,
should be or how we
yeah,
are? Yeah.
yeah. I,
Well,
I yeah. I really, I've always had this distaste. But when people say, "Why did that person do that? They should have done this," it's like,
mm,
I mean, talking about projections outward. And I always say, well, what would you have done in that same setting, reeling in that same state? So we start, in a sense, making moral decisions about other people's behaviors without understanding what physiological state they're in.
beautiful. What are some, we're just going to wrap this up. So, what are some resources for parents who are listening, kind of that have a similar, either books you've written or a similar kind of paradigm to what you believe in and your theory?
Well,
What is,
yeah, so I developed an acoustic intervention. It's called the Safe and Sound Protocol. And it was really designed to give distilled essence of trust through the auditory channel. So it's to send signals of safety to the body through intonation of vocalizations. Basically, think of the mother's voice, but now think of it as the prosodic features being amplified. And basically, it was to send a signal of safety that the body could not reject. Now, I learned a lot, especially as it moved from dealing with children who had basically attentional problems, auditory processing problems, to the world of trauma. When I start moving into the world of trauma, I learned something that is very profound that most people wouldn't guess, and that is signals of safety can trigger threat reactions in those with deep trauma histories. Now, what is that all about? Well, it's about the fact that signals of safety shift bodily state, and now the body becomes accessible, which is what you want. But if you have a history of being injured when you were accessible, the interoception, the feelings of that state of the body calming, goes up, and now your higher brain starts to interpret those feelings and says, got to get out of here. It's too
Mm-hmm.
dangerous. And you start seeing this even with kids when they start to kind of warm up in a setting. They say, can't handle it anymore. I get out of here. Um, so we start learning about the child, but the actual end result of that lesson was titration, that you can use those same types of acoustic signals to titrate the nervous system into becoming more familiar and less threatened by signals of safety. Just like you would with a rescued animal. You would
Mm-hmm.
talk with a prosodic voice, and then the animal would come, you'd feed it, and you do this multiple times, but you wouldn't overdose the situation. It would kind of like trigger something in the animal. So that's one. Another perspective, of course, is
Where do
breath
parents
work.
access that? Where would they?
Oh, they can go. There's a Unite, UNYTE.com, I think is the webpage, or just Google Safe and Sound Protocol
Okay.
Porges. It will probably come up.
Okay.
It's
Beautiful.
licensed to another company, but there are over 3,000 providers now, and they have basically affected tens of thousands
I've
of
seen the
people.
YouTube video on it, so I was,
Yeah,
but I'd
yeah.
have to find it.
It
Yeah.
it's quite interesting when if you have the opportunity to work with children with it, you can see with some of them. Not I'm not going to say all of them. You can see massive transformational changes that are shocking, that always tend to surprise me. But then the other thing that I am really a big fan of, breath work with older
Hmm.
children.
Yeah.
I have ideas of that you can use something like kazoos, which
Okay.
basically force. In fact, this is kind of like for parents to play with their kids. A family kazoo band is really kind of something that I think would be a lot of fun. But the real important point is slow exhalation, which is what you have to do when you hum to make the kazoo, actually enables that calming vagus to work. So it is literally a calming exercise. Slow exhalations, singing is slow exhalations. Wind instruments force you to have slow exhalation.
Hmm.
The kazoo, well, humming is a calming mechanism, and there are lots of, in a sense,
Yeah.
understanding the neurophysiology of singing and humming and breathing basically gives you a lot of justification of using those as neural exercises that
I've
promote
I've
calming.
I've read that even gargling can help
Yeah,
access the vagus nerve, and the vagus nerve, which just so everyone's listening, is helps with engaging your parasympathetic nervous system.
yeah,
So calming. That's the brakes of your brain. We want to hit tap the brakes a little bit.
yeah, yeah. And when I would say the agenda is not to, in a sense, space out. The agenda is to be calm enough that the
Mm.
other areas of your brain become available for creativity, exploration, for problem solving, for executive function. If you're in a state of terror or fear, those portals are not available because you have to basically stay alive.
Yeah. There was a book that we were talking about before we started this podcast called Brain Body Parenting, where Dr. Mona Delahook wrote a book based on your theory on parenting. And I assume you've read this book because I think it's revolutionary for how she's made your theory so accessible to parenting.
Well, Mona is one of these super therapists and super clinicians, and I always
She's
enjoy
amazing.
talking to her. And
Yeah.
she has this wonderful way of interacting and making people feel safe.
Yeah.
She basically focuses the work on I would say, recruiting neuroception of safety
Yeah.
and understanding that it's a portal. And we have to think of when we have children that don't feel safe, and this is really what the whole theme of this discussion is about, whether we call it anxiety, social withdrawal, depression. Uh, how do you engage the child by making them feel safe? And of course,
Hmm.
telling them to feel safe doesn't work.
No.
Or
Just like telling people to
it,
calm down doesn't work.
yeah, and the other part is, we think of safety as, basically, I'm going to use a thing, metal detectors keeping us safe, or principals carrying guns keeping us safe. We're missing what signals of safety really are.
Yeah.
It's not that removal of threat is bad, it's that it's far from enough. Our nervous systems need to be reassured that we're in safe environments. So we need people whose voices are prosodic, who have a degree of gentleness. Remember, our evolutionary history enabled us as humans to literally broadcast our own physiological states to others. And our physiological state, when broadcast, determines whether the other person's nervous system receives us as a friend or a foe.
Mm.
And so we,
Beautiful.
yeah,
Thank you so much. This I was very excited for this podcast just because I know for my own work with clients, I think you and Dr. Bruce Perry probably shifted my work the most. Uh, in terms of looking at healing from the bottom up, looking at
yeah,
that nervous system and working with the lower brain structures first, and
yeah.
making clients feel safe before we can do this more integrative approach with those higher brain regions. So, thank you so much for this very
Oh,
stimulating
oh,
conversation.
you're quite welcome. Let me just add with kind of a graphical visual. Just think of a triangle upside down,
Hmm.
and the apex, that little narrow part, that's your brainstem,
Yeah.
and everything's above it is, the smart brain, and that stuff above there needs that brainstem to be in a state of safety. Without it being in a state of safety, everything else is messed up. Cognitive function, including health functions. And this is part of what we forget. We think if you have a gut problem, that's the internist problem. That's not the mental health provider, not the parent. It's all connected. And we have
Yeah.
to understand that health is on multiple levels. And it's not that we have comorbidities. We have a body that is either in a state of threat or supporting our own health and restoration.
Beautiful. Well, thank you so much for your time. I know how valuable it is, and I'm still amazed we had you on here. So I'm just
Yeah.
going to be very grateful. So thank you so much for
Oh,
your time, Stephen.
thank you, Tammy. It was a
Okay.
really lovely interview. Enjoyed it myself.
Thank you.